Hello all, in this presentation we are going to see mnemonics in community medicine part 2. This is in continuation with the first part of mnemonics in community medicine. First mnemonic here is Apgar score. Apgar score, the mnemonic here is Apgar itself, APGAR, A for appearance, that is the color. The Apgar score, the minimum score will be 0, maximum score will be 10. So each criteria has 0, 1, 2. So maximum can be 10 and minimum can be 0. P stands for pulse, that is heart rate. G stands for grimace or reflex or irritability. A stands for activity or muscle tone. R stands for respiratory effort. Next mnemonic is for investigation of epidemic. There are 10 steps here. So VEPRA here is the mnemonic here. So V stands for verification of diagnosis. E stands for epidemic confirmation. P stands for population at risk definition. R stands for rapid search for all cases. A stands for analysis of the data or data analysis. And H is here. In book it will be 10 points. So here hypothesis, forming the hypothesis will be 6th point and testing the hypothesis will be 7th point. 8th point will be E for ecological factors evaluation, I for investigation, I for further investigation, further risk, R for report writing. So VIPRA here is the mnemonic for investigation of epidemic. Steps in RCT, we can have the mnemonic as PPRIFA. PPRIFA, P stands for protocol designing. Second P stands for population, that is selecting the reference population and experimental population. R stands for randomization. I stands for intervention. F stands for follow. A stands for assessment of outcome. So PPRIFA is the mnemonic for steps in RCT. Diseases following cyclical trends. So we can have the mnemonic as MRI cycle. M stands for measles, R stands for rubella, I stands for influenza pandemics, C here stands for chickenpox. So MRIC 4 diseases has cyclical trends. Measles have every 2 to 3 years, rubella has 6 to 9 years, influenza have cyclical trends every 10 to 15 years, chickenpox have every 2 to 5 years. Now for carcinogens in cigarette, PUNT is the mnemonic here. So P stands for polynuclear aromatic hydrocarbon, A stands for aromatic amines, N stands for nitrosamines, T stands for tar. PUNT is the mnemonic for carcinogens in cigarette. So diseases amenable to eradication. Those diseases which can be eradicated in near future is PGMD or MDPG. So P stands for poliomyelitis, G stands for guinea worm infection or dragon filariasis, M stands for measles and D stands for diphtheria. PGMD is the mnemonic for disease amenable to eradication. Diseases with no iceberg, which means there are no subclinical or carrier in the diseases. So here the mnemonic is MTR. So M stands for measles, T stands for tetanus, R stands for rubella. MTR is the mnemonic for diseases with no iceberg or no subclinical or carrier states. Bimodal age distribution of diseases is present in bimodal. So first and last letter is BL. So B stands for breast cancer, L stands for leukemia and lymphoma. The two, especially Hodgkin's lymphoma. So breast cancer, leukemia and Hodgkin's lymphoma are the diseases bimodal age distribution. Diseases under international surveillance, we have the mnemonic as MAS strip. M stands for malaria, R stands for relapsing fever, S stands for smallpox, T stands for typhus fever, R stands for respiratory, that is SARS, I stands for influenza A, P stands for poliomyelitis. So these are all the diseases under international surveillance. This is different from notifiable diseases under WHO. That is yellow cup we had, that is yellow Y stands for yellow fever and cup C stands for cholera, P stands for plague. Uses of epidemic. So respect is the mnemonic here. Here we have 2C. So R is here risk factors. So searching for causes and risk factors are. E stands for evaluation of risks and chances. S stands for syndrome identification. P and E will be combinedly as a single point in book. So planning and evaluation P and E. C completing natural history of disease. C, another C is for community diagnosis. T is to study the historical rise and fall of the disease in the population. So respect is the mnemonic for uses of epidemiology. We have Mala N and Mala D. We all know one is free, one is of cost, which will be provided in PHCs. Here how to remember this. Mala N is free of cost, N for no money. So you should remember. 7 cleans of delivery against neonatal tetanus. So first 5 will be given in the book. So this is clean hands, clean delivery surface, clean cord or clean cut or through the clean blade, and clean cord tie, clean cord stump, clean towel and clean water. These are all the 7 cleans to prevent neonatal tetanus during delivery. In man and medicine, we all know Charaka and Shush are notable personalities in Ayurveda. We all get confused between who is father of Indian medicine and father of Indian surgery. For this, S is the mnemonic here. S stands for surgery and S stands for Shushruta. So the other one, Charaka, will go for father of Indian medicine. Chinese medicine, Yang and Yin. We all get confused between which is positive and which is negative. Yin is negative, so Yin stands for N, so negative is the clue here. So the diseases where male predominance is present are given here as the mnemonic fly past, be like a male. So F stands for filariasis, L stands for leprosy, Y stands for yas, fly past, P stands for polio, A stands for acute respiratory infection, S stands for STD and AIDS, T stands for TB, typhoid, tetanus. We have 3 T here. B like a male, so B stands for brucella, L stands for leishmaniasis, K stands for KFD, male M stands for malaria. So fly past, B like a male is a mnemonic for male predominant diseases. Female predominant diseases, we have past as the mnemonic with 3 T. P stands for pertussis, A stands for ARI, adult in adult, S stands for STD, T stands for trachoma, and the other T stands for tetanus, the other T stands for typhoid. Other diseases will have equal sex distribution. So past with the 3T will be the mnemonic for female predominant diseases. Types of variables for that, Neuer is the mnemonic, N stands for nominal, O stands for ordinal, I stands for interval, R stands for ratio. For types of variable, Neuer is the mnemonic here. Hopefully this presentation was useful to you. Subscribe to the channel, click on the bell icon. Thank you very much.